The Canadian Foundation for Healthcare Improvement is dedicated to accelerating healthcare improvement and transformation for Canadians. We do this by collaborating with leaders in order to maximize healthcare efficiency and improve patient and family-centered care and outcomes. CFHI supports a range of activities that engage patients and their families in designing, delivering, and evaluating services with the goal of improving the quality of healthcare. For example, our Patient Engagement Projects Initiative, also known as PEP, launched in September 2010, has supported 17 decision-maker-led teams from across Canada. Through PEP, CFHI has learned a lot about the process and outcomes of meaningful and effective engagement. When patients and families collaborate with staff and health leaders, good things happen.
We know it is the right thing to do, and we're long past the time when we have to give a great deal of argument for not having the patient voice.
Si on est simplement en train de revoir comment on fait l'organisation des services en néphrologie, il m'apparaît aussi normal d'avoir un patient, par exemple, de la clinique de dialyse, qui participe à ces travaux-là pour nous donner, qui pose un regard critique sur la façon dont on veut réorganiser nos services. C'est pas facile, c'est pas une recette facile, mais c'est quelque chose de tellement enrichissant qu'on est convaincu que c'est la bonne voie.
A year after my husband died, my son was diagnosed with cancer. And when I went back to that center, which was an excruciating journey, I found these same absolutely wonderful people who didn't know that that was happening. They are hard-working, well-intentioned, amazing people who do what they do extremely well, and there was no way for them to know that there was this terrible gap in the system.
Nobody knows healthcare services the way families and patients do, and I think it's important to speak with them, listen to them, ask them about their experience so that we could have a better understanding of what it's like to experience the services.
We're smart. We're doctors, we're lawyers, we're dentists, we're mothers, we're family people. Some of us have never worked in our lives. That doesn't matter. We can take our intelligence and apply, and because we've been affected by the processes. What else are we here for? If not for the patient.
To me, meaningful patient engagement is about involving patients and their families in all aspects of the design and delivery of healthcare.
Well, meaningful engagement means that there is truly open communication and open dialogue and a recognition and mutual respect that's going on. I think often the opinion, the input, the knowledge of the individual and their relatives may be really minimized, like, what do you know about that? Or, you know, you don't have the same knowledge background I've got, except they bring a whole different perspective to things, whether it's how they're coping with the system. They know what challenges they've got in the workplace and at home, and those are all elements that are also important to be integrated into the plan.
We need patients and families as partners for improvement. This is different than advocacy. This is a collaborative endeavor where they share their insights, perspectives and experience, and listen to the insight, perspectives, and experience of those who work in the system, and it's together we will get profound change.
Everybody knows that we can ask patients to be part of an advisory council, but until we understand and with patients and families identify what the objectives of the engagement process are, what the aims are, and how we're going to work together, then we risk having token patients. We risk not really embedding the patient voice and the patient experience in our efforts to improve our services.
I think if we're really going to transform our healthcare systems, we have to invest in the development of our senior leaders. This work, they don't have to do all the work, but they have to understand the core concepts of patient and family-centered care, those strategies so they can integrate it in all the work they do.
We sort of hit this tipping point where everybody's talking about patients. They now have a voice, but they don't really have a vote. And when they do, it's going to change healthcare dramatically. That's why it's a bit scary for the providers. But it has to happen. So if you don't have patient-centered care, your system's never going to be effective. And if it's not effective, it's not going to be efficient.
Last year, for the first time, we had a public committee that sat as part of our business plan. So brought people into our organization so they could give us their feedback on how we were spending taxpayers' money. We thought we understood what people wanted, but it's amazing when you take the time to ask and when you take the time to deeply listen to what people are saying. So without that patient voice at the table, we're not going to get there. So we should have been doing this all along. And some of us did, and some of us were, slower on the uptake on that, but it is essential. It's not optional anymore. It's essential that we engage in the conversations with our patients, families, and communities.
I think we can look at patient engagement a couple of ways. We can look at it in terms of dialogue, and I think that's important. But we can also look at it in the developmental stages in our health system. So when we start to think about options, to me is the point where we should be talking to patients, not just asking them for feedback after we've made a decision as government and hoping that we did the right thing.
We have advisory groups full of patients and family representatives, but we're still not listening to the full degree. I mean, we're working hard on it. We don't want just patient-centered initiatives. We want patient-centered thinking embedded in everything we do. And that's easier said than done. So I'm encouraged that we're talking about it, but we really have to live it.
Most of us have had a bad experience of one kind or another, and we don't have control over the bad things that happen to us, but we have some control over how we respond to that. So it seems to me that the best thing you can do with a bad experience is to just try to make it better for the next person, and I'm very grateful to have an opportunity to do that.
CFHI looks forward to the day when patient and family engagement is hardwired into the everyday structure and culture of organizations. Our own PEP experience has demonstrated that co-designing improvements with patients and/or their families leads to different insights and better results than providers working on their own. We improve healthcare when patients, family, and providers are equal partners.